my name is Dr. Matthew Ziegelman, and I'm a urologist at Mayo Clinic in Rochester, Minnesota. Our article is entitled Wide Variation in Postoperative Urologic Surgery Opioid Prescribing in Tertiary Care Centers. This article will appear in an upcoming volume of Mayo Clinic Proceedings. It is clear that our country is facing an opioid epidemic. The drug overdose death rate has essentially tripled over the past 2 decades, and this is due in large part to misuse and abuse of prescription opioids. Postoperative pain control is an important consideration for surgeons in all specialties, yet there is little published data regarding opioid prescribing in the postoperative period, particularly in urologic surgery literature. Our goal with the current project was to evaluate our own provider prescribing patterns in patients undergoing common urological surgical procedures at Mayo Clinic in Rochester, Florida, and Arizona campuses, through a collaboration between the departments of urology, anesthesiology, nursing, pharmacy, and the Robert D. and Patricia E. Kern Center for the Science of Healthcare Delivery Surgical Outcomes program. We were able to evaluate institutional postoperative prescribing patterns for urologic surgical patients undergoing one of 21 common procedures over a 2-year time frame. In total, over 11,800 patients were analyzed. We identified striking and seemingly unwarranted variation in opioid prescribing patterns within and amongst the procedures that were analyzed. On multivariable analysis, in those patients who received more opioids, we found that they were younger, female patients, and more commonly had a cancer diagnosis. In comparison, those patients who were more likely to receive an opioid refill were younger male patients with a benign diagnosis. We feel that this data has important implications for the development of more standardized, evidence-based protocols for postoperative opioid prescribing, and offers our institutions an opportunity to act as stewards in the fight to stem opioid overprescribing. Our findings have important implications not only for surgical specialties, but also for all providers who interact with patients in the perioperative period. Data from this large cohort of surgical patients supports the need for rational strategies for postoperative prescribing. Examples may include the development of educational protocols and clinical guidance documents, both of which are clearly lacking within not only urology, but also many other areas. Patients are increasingly savvy about their medical care, and it is extremely common for patients to ask pointed and poignant questions about perioperative pain management, particularly with respect to opioids, during our preoperative consultations. Patients understand that we as a society are in the midst of an opioid crisis, and they are particularly concerned about issues such as developing addiction. Pursuing this type of research shows our patients that we are cognizant of their concerns and that we are taking steps to address them. Now that we have our historical prescribing data, our next step is to put that data into action. We have convened an opioid task force that is made up of urologists, anesthesiologists, nurses, pharmacists, and health services researchers from the 3 institutions. Together, we have developed an evidence-based postoperative opioid prescribing guideline for opioid-naive patients undergoing common urologic surgical procedures. This guideline was recently implemented into our clinical practice, and we plan to perform a subsequent data analysis comparing our prescribing patterns both before and after guideline implementation. Thank you for your attention, and I hope that you find this article useful in your daily practice.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.